is Deisha Williams. I'm a biology professional major from Portsmouth, Virginia. And today I will be talking to you about exploring a new emerging disease, Ebola. This is for my seminar class with Dr. Akpodi. What is Ebola? Ebola is a virus disease formerly known as Ebola fever. Ebola is a rare but deadly virus that causes bleeding inside the body and outside of the body. Ebola is a very, very high-risk disease and has been known to kill up to 90% of those who become affected with it. So Ebola is a very serious virus and it kills within like 2 to 3 weeks at the longest. The history of Ebola. Ebola started in Africa in 1976. Ebola, named after the Ebola River in Zaire, first emerged in Sudan and Zaire. The first outbreak of Ebola, it infected over 284 people with a mortality rate of 53%. A few months later, the second outbreak came from Yambuku, Zaire, that killed over 318 people with a mortality rate of 88%. So the Ebola disease is very serious and very deadly, and it killed over half as many people within the first and the second outbreak. How does Ebola spread? So a lot of people know about the Ebola virus, but they don't know how you can get infected with it or how it's contracted. So I'm here to tell you how does Ebola spread. Ebola isn't as contagious as most common viruses, as the common cold or the flu or even the measles. Ebola is transmitted by blood or body fluids, but it is not limited to urine and vomit of a person who is sick with Ebola. So the only way you can become contracted with the virus is when someone already has the virus and it's spread through body fluids. You can also get the Ebola virus if someone is affected with the virus and they use objects as in needles or syringes that have already been contaminated with the virus. Infected animals as well, they can also cough and sneeze and they can spread the virus like that as well. Ebola is not spread through air or by water, in general food. However, in Africa, Ebola may be spread as a result of handling bushmeat. So as the bushmeat, as we were saying about the Ebola virus, if a butcher is slicing an animal that has the Ebola virus and you are eating the meat, then you too have the Ebola virus. Health effects of Ebola. So how do you know if you have Ebola? Here are some symptoms that bring awareness to you diagnosing yourself with the virus. If you have joint and muscle pains, vision and hearing loss, abdominal pains, headaches, vomiting, rash and diarrhea, a sore throat or internal bleeding. So all of these are serious symptoms, early stages of the Ebola virus. Curing Ebola. There is no approved vaccine or medicine that cures Ebola. Orthodox medicine helps treat Ebola along with high dose of vitamin C. Treatments include experimental serum or that destroys infected cells. Doctors manage the symptoms with Ebola, fluids, and electrolytes. As far as the Ebola virus, I didn't find any studies of anyone who survived with the virus or who had the virus and lived. So there's no common cure or there's no fast cure for the Ebola virus. The pros and cons of Ebola. You can help inform those who are familiar with the disease. So if someone If you are informed of the disease or you have a lot of information on the Ebola virus, spread the word. Inform someone who doesn't know about Ebola and talk to them about, hey, if you're around someone and you're around Africa or a country that has a high volume of the Ebola virus, just make sure that you sanitize your hands, you wear gloves, everyone covers their mouth around you. Just ways to prevent the Ebola virus. Bring awareness to people and stay away from infected environments, as so the two infected places, or if you just read up on where the Ebola virus is. As in Africa, I know they had the Ebola virus in Mexico 2 years back, so just be sure to be cautious when you go to those places. But it could also harm humans, animals, the environment, and the wildlife. As far as the Ebola virus disease and critical illness, this is in 2006. The source was the Biomed Syndrome. According to the World Health Organization, or May 20th, 2016, there have been 28,646 cases and 11,323 deaths resulting from the West African Ebola virus disease. And this is all coming from the Biomed Syndrome. The experience of this outbreak emphasized that evoluting specific medical treatments, improving the global capacity to provide supportive critical care to patients with severe illnesses, may be associated with the greatest opportunity to improve the patient outcomes. This article focuses on how to maintain the Ebola virus and how the medical treatments are and how to prevent the virus from spreading. The Ebola cases in West Africa. This is studies from 2014 from the Environmental Research. The total number of Ebola cases in West Africa as of October 14, 2014. So around June the 3rd, volumes of Ebola cases were very low. And this comes from 3 countries in Africa: Liberia, Guinea, and Syria. As far as the 17th of June and the 1st of July, studies are still very low. July 15, they're about the same, but as far as Syria, they are increasing. July 29th through August 12th, the case studies begin to increase, and the studies begin to increase as well throughout August and September. And on October 7th, there has been sky-high volumes of cases of Ebola in West Africa. The Ebola virus disease in West Africa. This is studies from 2014 as well. The sources came from the New England Journal of Medicine. Case control study which observed relationships between Ebola and West Africa. So this is really focusing on the studies of Ebola and how Ebola is in the country of West Africa. It found high volumes of Ebola in West Africa. 2,296 deaths from the virus had been reported from 5 countries in West Africa: Guinea, Liberia, Nigeria, Senegal, and Syria. The estimate has now become so large that the 3 most affected countries are Guinea, Liberia, and Syria. The populations of those 3 countries are highly interconnected with as much cross-border trafficking at the epicenter and relative easy connections by roads between rural towns and villages between populated national capitals. So between those 3 countries, that's where the most trafficking comes in and people are cross-border and how high volume. So as people come in and out of the country, those are the three countries that it'll come in. So Ebola does take a big toll on already poor healthcare, and this is a source from Yahoo News. The article also focuses on the Ebola virus in three major countries. In three major countries: Syria, Libya, Nigeria, and Senegal. It too talks about how Dr. Khan and his team of doctors. This article interests me the most because out of all the articles, this is the one that the author knew someone who was affected by the virus, and he became affected because he was a doctor and he was treating patients with the Ebola virus, and he contracted the virus. So him trying to help someone and he became affected, this article, it touched me the most. It talks about how he caught the virus and how he died after. It also talks about the symptoms of the virus and why doctors decline this line of work. So a lot of doctors really wouldn't go into the Ebola healthcare and wouldn't try to treat patients who have this virus because it's so easily contracted and they can come contracted with the virus and there's no cure for the virus. So it's a 50-50 when it comes to this. So overall, this disease is spread worldwide, but has the most attention in Africa, West Africa to be exact. Many Africans have died from this untreated disease. The symptoms and signs of this virus tend to show within as little as 2 days or as late as 3 weeks once you have become a contractor with it. The indicators include a sore throat, a high fever, light headaches, and muscle pains. Some individuals develop a rash, diarrhea, vomiting, and as soon after, the kidneys and liver in your body begin to slow down and bleed internally and externally. Ebola is a very high-risk disease and has been known to kill up to 90% of those who become affected with it. The Ebola is popular in the media today due to more individuals contracted with it. So times I'm available this week are Monday between the hours of 2 p.m. and 6 p.m. I'm not available on Tuesday. Wednesday between 9 a.m. and 3 p.m. Thursday I'm not available, but Friday I am available between 9 a.m. and 6 p.m. And this is just my works cited page. It talks about where I got my resources from and where I got my information. I really focuses on the World Health Organization. It talks about the Ebola virus disease and the Cuban medical team handling people who are contracted with the Ebola virus. Also the International Ebola Emergency. That's where I got Mrs. Cox's information and how I really focused on how she became with the World Health Organization, whose statements on the meetings and the international health regulations, and also the Centers of Disease Control and Prevention. Also talked about the outbreak of the Ebola in Uganda. So all of these talked about the Ebola virus. I really hope that I inform someone and I pursue someone to actually be more informed about this virus, because health is something that you should take very seriously, especially something as deadly as the Ebola virus. And I really hope that you enjoyed my presentation. And as far as the Ebola that takes a big toll on our really poor health. Another reason why this article did touch me is because a lot of people can't afford health care, and something as serious as the Ebola virus is why I like this article the most.